Okay, so as a computer scientist, one of the things that I like most about technology is its ability to empower people, right? And as a PhD student, the core area of my research is to build technology for helping a similar group of people, which is the arthritis patients and the clinicians which support these arthritis patients. Now, arthritis is a common term which is used to explain a variety of disorders which primarily affect joints and other parts of body by causing inflammation. And when an inflammation is caused in the joints, it causes immobility in the joints. People cannot move. And so what you see on the top left is a normal joint followed by an arthritis-affected joint where arthritis or inflammation is caused because of the tear of cartilage. This next one is rheumatoid arthritis, where your own immune system is attacking your healthy tissue around the joints. The bottom line, when you get arthritis, it causes a lot of pain, it affects your social life, your work life, and you can't move. Now, the bad news is there is no cure for arthritis. The good news is you can do something to manage your symptoms. One of the things that you can do to manage your symptoms is to maintain a non-sedentary lifestyle, which means moving up every hour from your chair, walking around a little for 5 minutes. And the second thing you can do is to do moderate intensity exercises every day. Now, the problem is if you do too much exercise, it will cause more pain in the joints, it will worsen your situation. On the other hand, if you don't do sufficient exercise, you are going to not have any effects of the exercise, right? So the dilemma, am I doing enough exercise or am I doing too much, right? And so to solve this dilemma, I think, as a computer scientist, how can I help these people? And so what we did is develop this web application. What you see is the visualization there. And so normal health activity trackers like Fitbit, what they do is they'll track activity for individuals, but they are designed for healthy individuals, right? So they do not customize their data analysis for the patients. And so what we do is we take Fitbit data from the patients. So patients wear the Fitbit on their wrists. We take the Fitbit data. We take a personalized patient plan from their physicians. We combine this data, crunch the numbers, and develop a visualization. What you see are the green bars where we tell the patients and their doctors when the patient is doing enough. And if you see the first bar, which shows some curly lines or heat marks, and the last one, which shows sweat drops, we tell the patients when they are doing too much. Now, we did a pilot study, and we found that wearable technology like this helped patients and clinicians in 3 different ways. The first one was raising awareness of their everyday behavior. The second was helping them in a strategy. The third was the patient-clinician communications, where they no longer have to explain to their doctors whether they are meeting the goals or not. The doctor can just see whether they have met the goals. Thank you. Questions?
Thank you so much. Yeah, so we can take a couple questions.
Yeah.
So did you compare it to a control?
Yeah, so what we did was a pilot study with 20 patients. And so first group basically did not so it was a post-intervention. So the first group did not get any kind of external aid. They were just told by their physicians to move more. And the second group was given this device and the access to the web app, and we basically did a qualitative study after that. We are also doing a randomized clinical trial right now with Arthritis Research Canada to basically see if this applies for a larger sample.
So you didn't do people who just had the band, they didn't have the program part?
I didn't have what?
Just had the Fitbit and not the program part?
Yeah. So the control group did have a device so that they can track their activity, but Fitbit doesn't customize the data because the ability of every patient is different, like how much they can do. And so Fitbit will just assume that you are a healthy individual who can do like vigorous exercises, like 30 minutes or an hour every day.
Any other questions?
Yeah.
Can you adapt it to any kind of like knee or just like joint disease or arthritis?
So basically the idea was to have sufficient exercise to like monitor. And so wherever, like even for other diseases where doctors recommend enough physical activity every day, you can basically modify this for that population. The key thing here was basically the first bar where it says like the heat marks and the sweat drops, because if you do too much exercise, it will cause too much pain. So for arthritis people, we wanted to tell them and their doctors, like, okay, hey, on Tuesday you did too much, or on Wednesday you didn't do enough, kind of thing. Yeah.
Who were the physician partners that you worked with?
These are physiotherapists and rheumatologists at Arthritis Research Canada, which is located in Richmond, and one or two profs are actually a faculty at UBC as well.
Alrighty, thank you so much.